Hello, this presentation is going to be about autism spectrum disorder. I am role A. My name is Cheyenne Lofthouse Wolf. And just diving a little bit into the introduction about autism spectrum disorder. It is a neurodevelopmental disorder. Typically, it is diagnosed amongst children. There is a spectrum of different behavioral manifestations, signs, and symptoms. Typically, it's affected by their social interaction and communication with others are affected. That can look like, for example, in my role as a mental health counselor, we have an autistic young lady who has difficulty being around male students. And so that would be kind of her. Going into the next slide, that would be kind of some of her restricted behaviors. Something else she shows is she has difficulty being the last one in line. This is just sort of how her brain is wired, and that looks quite different in many people with autism. There's a spectrum of disorders, capabilities, even intelligence, and they show a display of different variety of behaviors, repetitive or restricted behaviors. Oftentimes it's hard for those with autism to recognize emotions or thoughts within others. Typically, well, granted there's a spectrum, but typically you'll see that they may have a hard time understanding how others are affected by their statements or feelings. So there is a lot of social intelligence that comes into play here. Going into the overview of autism. Autism is a disorder where social and behavioral interactions are affected, which we spoke about a little bit earlier. And according to the American Speech Language Hearing Association, those with autism may show stereotyped repetitive speech, motor movement, or use of objects, inflexible adherence to routines. So that was like the young girl I had discussed in her difficulty standing in a line with others or being around male students. And then it continues on to say restricted interest in hyper and or hyposensitivity to sensory input. Diving into some of our DSM-5 criteria, I'm not going to go over all this just because I want to make sure we have enough time to get into the video I have planned a little bit later. But I will do a quick overview of the DSM-5 criteria, which includes some deficits in social emotional ranging, for example, from abnormal social approach and failure of normal back and forth conversation, to reduced sharing of interest, emotions, or affect, to failure to initiate or respond to social interactions. So just tying it back into our overview, this is the difficulty of social interactions that those with autism may experience. Continuing on, there are deficits in nonverbal communicative behaviors used for social interaction, ranging, for example, from poorly integrated verbal and nonverbal communication to abnormalities in eye contact and body language, or deficits in understanding and use of gestures, or total lack of facial expressions and nonverbal communication, tying it back to their difficulty in recognizing thoughts and emotions in others and their repetitive or restricted behaviors. The rest we sort of already spoke about already, but just continuing on. There is an insistence or sameness in flexible adherence to routines or ritualized patterns of verbal or nonverbal behaviors, highly restricted, fixated interests that are abnormal in intensity or focus, hyper or hypoactivity in sensory input or usual interest in sensory aspects of the environment. Symptoms must be present in early developmental period, but may not become fully manifest until social demands exceed limited capacities. In my experience, typically the diagnosis comes out around elementary. I may be wrong, as everyone is different, but just in the programs that I am a part of, that is just typically what I see in my field. Um, it does have an impairment in social, occupational, and other important areas of current functioning. So that is kind of the overview of the DSM-5 criteria. And just to give my viewers a little bit more visuals, I have set up a video for us here. So sit back, please enjoy, and I hope you learn some new things about autism. Thanks. Great. Thank you so much for watching that. I hope it really helped bring kind of a more visual understanding to the different brain of an autistic person. Thanks again for watching our condition presentation on the autism spectrum disorder. Once again, I am Role A, Cheyenne Lofthouse Wolf, and please feel free to take a deeper look at our references located here. Thank you so much, and hope to talk to you guys soon. Thanks.